Today, I want to talk about the growing crisis in Canada, a crisis affecting tens of thousands of autistic children, and a crisis government after government has failed to fix. Right now, many autistic kids are waiting for a diagnosis, waiting for therapy, waiting for support, and in some cases, waiting for years. This is not one family's problem. This is a national issue, and it will shape Canada's future. So let's break this down with the real data. This is future PM of Canada. Let's talk honestly. Across Canada, about 1 in 50 children has been diagnosed with autism. That's roughly 2% of all Canadian kids. But advocacy groups say the real number is likely higher because many children are still waiting for assessment. Not diagnosed, not counted, not supported. Tens of thousands of autistic kids live in Canada today. The question is, how many are actually getting help? And how many are just stuck in a queue? In Canada, autism funding is a provincial responsibility. So what support you get depends entirely on where you live. Some provinces provide direct funding, some only fund certain services, some cut support at a certain age, some have extremely long waitlists. For parents, it doesn't feel like a system. It feels like a lottery. Take Ontario as an example. More than 50,000 children are on the Ontario Autism Program waitlist. Recent reports put that number closer to 60,000 or even 70,000. That means you could fill the Rogers Centre twice with autistic children waiting for help in just one province. And many of these kids might wait for years. Let's talk about what this looks like in real life. First, diagnosis delays. Some families wait a year or more just to get an assessment. During that time, children miss the critical early window for intervention. Second, out-of-pocket cost. Therapy can cost tens of thousands of dollars per year. Some families pay $20,000, some pay $60,000, some pay more. Most Canadian families simply cannot afford that. Third, inconsistent support. Even when funding arrives, it often doesn't cover everything. Families may have to choose between speech therapy, ABA, OT, or mental health support. Rural and remote areas may not even have providers. So getting funding doesn't always mean getting help. From a human perspective, early help changes lives. From an economic perspective, it also saves money. Studies show that when autistic kids receive strong early intervention, their communication, learning, and independence improve significantly. Without support, long-term care costs rise. Lost productivity increases. Families experience burnout. Governments think they save money by delaying support. The truth is the opposite. They are creating much higher cost in the future. Spend early and smart, or spend later and heavily. Now let's zoom out. Autism is not rare. 2% of Canadian children are autistic. If these children do not receive timely support, Canada loses an entire generation of potential. Many autistic people have incredible strengths, pattern recognition, memory, analytical ability, focus, but without early support, we risk shutting the door on their potential. There is also a massive economic impact. Parents reduce work hours, some leave their jobs entirely. Families fall into stress and poverty. Costs simply shift from healthcare to social services to adult disability programs. And there is a trust issue. When support depends on your postal code or on whether you can afford private therapy, people lost faith in the system. A country cannot function when families feel abandoned. So, what does a serious national plan look like? Number one, create national baseline standards for autism services, not identical programs, but minimum requirements every province must meet. Number two, make waitlists transparent. Families deserve real numbers, not guesses. Number three, Use federal funding to support early childhood autism intervention directly with accountability. Number 4. Build integrated models where schools, healthcare, and social services share responsibility. Number 5. Measure long term outcomes, track progress, use data to adjust policies. If we expect autistic Canadians to contribute to our society and workforce, then policy must treat them as contributors, not as costs. When an autistic child sits on a waitlist, the system is saying, "We will deal with you later." But later is too late. Too late for the development, too late for communication, too late for families already overwhelmed. This isn't just about autism, it's about the future of Canada. A country that delays support for its most vulnerable children is a country delaying its own future. My name is Imran. This is the future PM of Canada. If you believe Canada needs to support autistic children with urgency and dignity, subscribe, share this video, and let's push for a smarter, stronger, future focused Canada.